I'm David Bennett. I'm the EVP Product and Strategy for Orion Health. I'm based out of the U.S., but I'm responsible for products worldwide focused on population health management. So the session was primarily focused on the future of healthcare and where population health management is going.
Thank you. And how has mandatory health insurance affected the region?
The pros of it obviously are, I think most countries feel like it's a right for their citizens to have health insurance and have some kind of safety net at some level. The cons is that we're not really good at understanding our populations and understanding actually how to provide the right care at the right time. So we have to get policy needs more sophistication on the technology side and the people in the process side to actually provide better health care in that context, because services and access to services are going to be a problem as you do that.
And what is the status of health insurance in the Middle East when compared to developed nations? And what are the steps needed to be taken to improve this?
I think the difference in the Middle East compared to some of the other nations, U.S., Canada, they're actually more sophisticated on the integration of information and leveraging that information to take care of their patients. And payers, either public funded payers or privately funded payers, are actually heavily involved in helping that occur. And that probably hasn't been what's happened in the Middle East yet, but I believe it will because it's happening worldwide.
How do you think the MENA Health Insurance Congress helps address the current challenges?
Anytime you have a forum where you have a mixture of different healthcare system providers, it's a provider, a payer, pharmacy was here, medical devices were here, diagnostics was here. Anytime you get people from, sometimes they're trying to compete for margin, but getting them into a room and saying, look, these are the problems with our system, we need to optimize our system, we need to improve the care, we need to flatten out the curve. At the same time, make these businesses sustainable. It's a good thing for the industry.
Okay. And how did you find the Congress so far? How was your experience of it?
Actually, I changed my presentation a little bit because of all the great questions that we had during the day, and I felt like I wanted to interject a few comments that I'd seen around the world. So for me, it was quite educational, and it actually was fairly close to a lot of the same problems that I've seen in other countries, so it wasn't like it was so unique, but that's why I wanted to give some other patterns and some other examples in other places.
Thank you very much for your time, Mr. David Bennett.
Thank you very much. Appreciate it.